as National Minority Health Month. This month builds awareness about the disproportionate burden of premature death and illnesses in the minority populations. Did you know, according to the Centers for Disease Control, breastfeeding disparities affecting minorities include Black infants are 21% less likely to have ever been breastfed than white infants. Mothers ages 20 to 29 years old are less likely to have ever breastfed than mothers ages 30 years and older. As you look around, you will see an array of beautiful Black mothers posing breastfeeding their babies. They are showing the world and our community that breastfeeding is normal. I would like to say publicly, thank you for being a part of our campaign to help normalize breastfeeding. I now introduce to you Delia Hasbury, the REACH Program Coordinator, to tell you a little bit about the grant as well as our campaign.
Good morning, ladies and gentlemen. Thank you, Gandhi. I am Delia Hasbury. I am the REACH Program Coordinator. As Gandhi stated, REACH stands for Racial and Ethnic Approaches to Community Health. We are in year 3 of a 5-year cooperative agreement. Our target population is African Americans that reside statistically in low education, low income areas within the 42 census tracts of Lowndes, Macon, and Montgomery counties. Our overall goal with REACH is to provide healthy food access, healthcare access, through various health and nutritional strategies, including healthy corner stores, health ministry, tobacco prevention, community and clinical linkages, and last but not least, the reason you all are here with us today, breastfeeding initiatives. So in the words of our Executive Director, Ms. Gandhi Daniels, we pride ourselves in reaching people where they are and working with all things dealing with wellness. This year we have been busy. In May, we'll be launching our virtual breastfeeding support groups. In June, we are hosting a panel of mothers that will discuss all things dealing with breastfeeding. August, we'll host our breastfeeding summit to educate, promote, and encourage, and keep the conversation going about normalizing breastfeeding. If you have not done so already, to stay up to date on our updates, go like us on Facebook, go subscribe to our newsletters and updates on the Wellness Coalition website. I want to take the time to thank our photographer, Ms. Sydney Howard, for capturing these beautiful images you all see. I want to take the time to thank the sites throughout Montgomery and Macon and Lowndes counties and beyond that requested cutouts in their locations. Even in some of those sites due to COVID, they had traffic that was foot traffic stopped. They still wanted them to be in the background of their Zoom meetings. So healthcare professionals, representatives, other mothers, and other individuals in the community could see these mothers breastfeeding in the background because they need to be seen. We also want to thank those mothers for allowing us to be a part of their breastfeeding journey. These are beautiful images, as you all can see, and we are proud of those mothers that they felt confident enough to share them with us. They know they have a choice, better yet the right to breastfeed. Whenever you see an article about breastfeeding, I can guarantee you it's always one negative comment. We get it, you breastfeed. Why do you want to share it? Why do we have to see a picture of it? How old is the baby? Aren't you supposed to stop at a certain age? This is why we must normalize breastfeeding, for that exact reason. We need to erase years of programming of carrying guilt and shame. But you know what else? I see many men, many women that are defenders and supporters of the movement of normalizing breastfeeding. I have great pleasure to introduce you to our speakers for today. Many of these women have been working their entire careers to advocate for women, advocate for breastfeeding, encouraging policy change and breastfeeding to where we are now. Please support resources for nursing moms. These actions help moms who want to breastfeed but have no idea how. You all may know her as our REACH community liaison, but she's also a breastfeeding advocate and a birth and postpartum doula. Ladies and gentlemen, please join me in welcoming our first speaker, Mr. Rika Vaughn.
Thank you. Good morning, everyone. As Delia stated, I am Derika Vaughn. Not only am I a community liaison, but I am a birth and postpartum doula. and a breastfeeding advocate, and most importantly, I am a mother. It is an honor to share a part of my breastfeeding story with you today. When I found out I was pregnant with my son, I knew I would breastfeed. I had heard it was the healthiest source of nutrition for babies, and I knew I wanted nothing but the best for my son. The funny thing is, I knew I hadn't gotten that advice from a healthcare provider or my family members. At my first prenatal visit, I recall receiving a can of formula, and I said to myself, I'm not using that. I had not done much research, but I knew what I wanted. After delivering Dawson, my son, the nurse placed him on my chest and he instantly began to latch. I was fortunate enough to have a lactation nurse who allowed me to come back in for a consultation when I had questioning about his latching. Unfortunately, I wasn't able to take her home with me. I began researching breastfeeding information because I knew it would be a journey and a challenge, and it would teach me to grow. I was unaware of the available resources to me. A couple of months later, I found myself being able to answer breastfeeding questions for social media friends, family, and some of my greatest friends. I was posting pictures of me breastfeeding my son with a smile on my face. I was never afraid to share my breastfeeding story because breastfeeding is normal. For so many women of color, we are unaware of available resources, unaware of the significance of having those resources in our lives, or we simply do not have the support we need from our family, friends, healthcare providers, or employers to pursue the breastfeeding journey. We have the lowest breastfeeding initiation rates in the United States. Like many, I didn't have the research that I needed for breastfeeding, and I didn't have the education before I delivered my son, which is why I advocate for breastfeeding and empower mothers like me to get educated earlier in their pregnancy and to breastfeed for as long as they choose. Normalizing breastfeeding will take a community effort, and what better way is there than to involve community partners? The Wellness Coalition has provided many efforts to provide breastfeeding education and bring more awareness to the nutritious feeding method. Although some mothers frequently experience breastfeeding barriers, there are organizations in the surrounding areas that are waiting to provide resources. Today, we have placed 4.5 to 5 feet life-size breastfeeding cutouts at partner organizations to help the public see that breastfeeding is normal. With much confidence, I believe this effort will lead more pregnant mothers and their support systems to seek more breastfeeding education, birth worker services, and community organization services. I am beyond excited to see the outcomes from this campaign. Next, we will have Adila Smith. She is a birth doula in the community. She is a lactation consultant, and most importantly to me, she is a mother of 2 beautiful daughters. Adila.
Good morning, everyone. All right, good morning, everyone. I stand here, as she said, I'm Adila Smith. I stand here during Black Maternal Health Week as a lactation professional, a doula, and most importantly, a mother. Not just a mother, but a Black mother who chose to breastfeed. I've been privileged to be part of this campaign, both behind the scenes as a consultant, as well as in front of the camera as a cutout model. While many people know the importance of breastfeeding for mothers as well as their babies, oftentimes societal barriers and influences hinder that initiation and continuation of breastfeeding. Breastfeeding is normal, yet for much of Black America, it's been stolen and shamed, but today we stand here to move forward as we reclaim and restore. This campaign highlights the beauty and the art of breastfeeding of local Black mothers, but more importantly, it starts a conversation. As this art is intentionally placed throughout Macon, Lowndes, and Montgomery counties, the hope is that meaningful discussions will go forward about breastfeeding, particularly within the Black community. When you see these cutouts placed, take the time to learn something important about breastfeeding and share it with someone. Your conversation has the power to change maternal and infant outcomes in our state and beyond. There is no better time than now to rally around expectant and nursing mothers in choosing to breastfeed. Affirm them in their choices. Go forward. You can be a change that we need to see. Thank you. I'm going to introduce Dr. Regina Traylor, Director of the Gift of Life Foundation.
Okay, I'll try to. That's okay. Thank you, Ms. Danny. Thank you to the Wellness Coalition staff for inviting me here today, as well as partnering with the Gift of Life Foundation regarding such an important platform. This morning, I just want to speak briefly with you to share some of the importance of breastfeeding and the need for normalization. First, I think it's important that we note 5 things, though, about breastfeeding. Number 1, it's beautiful, it's normal, it's healthy, it's cost-effective, and it's legal. Breastfeeding offers a mother and the baby a wonderful bonding opportunity on a consistent basis. Research has shown that the mother-infant bonding that takes place during breastfeeding can result in positive feeding experiences. Likewise, the mother's sensitivity is elevated in regards to the infant needs during that time. This can be especially important to someone who is experiencing breastfeeding or parenting for the very first time. The American Psychological Association has suggested that maternal sensitivity can extend well beyond the infant and the toddler years. A woman's body is uniquely designed to offer one of the most beneficial supplements to a young human's body. Unfortunately, many women have encountered embarrassment and shaming for offering this natural supplement in public and sometimes within enclosed settings. Let's think about this for just a moment. When a parent or guardian hears a child crying, what is typically the initial response? You want to identify what's wrong and immediately console that child. When we see something consistently, we can become desensitized to it because it becomes the norm. It is typical to expect a parent or guardian to console a crying child. Therefore, when an infant is hungry, regardless of its surroundings, there should not be a sense of embarrassment or shame to breastfeed. The more we see it happening, the more normal it will or should become. Also, breastfeeding in public is legal and protected by federal and state laws in all 50 states. Breastfeeding is beneficial to the infant, but also to the mother. Breast milk offers a wealth of easy-to-absorb nutrients, such as antioxidants, enzymes, improves immune properties, and live antibodies from the mother. Therefore, the infant can develop a stronger immune system, are less likely to deal with diarrhea, constipation, and a few other gastric challenges. Likewise, the research has shown that infants have fewer colds and respiratory illnesses when they are breastfed. A few other benefits would be fewer ear infections, better vision, and some suggest lowering of the infant mortality and sudden infant death. The mother also benefits through the promotion of faster weight loss after birth, the stimulation of the uterus to contract and return to a normal size, and through urinary tract infections, and that's just to name a few of the benefits. But mothers who choose also to breastfeed, the economic benefits are immeasurable. Technically, as long as there is a sufficient supply of milk, there is no cost. Of course, there's different accessories that a mother can acquire, such as a breast pump, nursing bras, pillows, and so forth, but essentially it's free. We could probably address a number of reasons today why we do not see the normalization of breastfeeding as much as other countries, and particularly in our African American population. However, I think our time is better spent addressing what we can do to ensure families, mothers, feel comfortable breastfeeding. Education promotes empowerment. If we increase a mother and father's knowledge and skills about the benefits of breastfeeding and help them view breastfeeding as normal, despite what may be considered societal norms, then it is my belief that there will be a positive attitude towards breastfeeding. At the Gift of Life Foundation, and since 2016, we saw the breastfeeding initiation rates increase from 55% to 69% as of 2020. The sustaining of breastfeeding at 6 months postpartum shifted from 29% in 2016 up to 44% in 2020. While I'm saying those may not be the best numbers, there's definitely an increase. We attribute that change to investment in education. We incorporate education into home visits with our mothers and their families, group activities, social media, and partnerships with other breastfeeding champions, such as what you see today with the Wellness Coalition, and outreach events designed for program participants. We train some of our staff to become certified lactation counselors. We also ensure that education is not focused only on the mom, but the father of the child and the family members that are involved. We have found that mothers that are supported are more apt to stay the course with breastfeeding. We also focus on educating the community about breastfeeding and making a space for mothers to be supported. A mother should never feel they have to make a choice between staying at home with their child or stop breastfeeding to return to work. As a community and society, we need to support the normalization of breastfeeding to create a stronger and healthier community. Thank you for your time.
Thank you, Dr. Traylor. Now I have the opportunity of introducing Dr. Tiffany Taft. She is also a birth doula here in Montgomery, as well as the owner of Sacred Soul Wellness. Please help me to welcome Dr. Tiffany Taft.
Before Dr. Taft comes to speak, I would be remiss if I did not introduce the photographer, Miss Sydney Foster. Come on up, Sydney, for 1 second. Thank you for your service, but she has been so gracious and she has to get back to duty, but I do want to allow you to say a few things. I know, just...
Hey everyone for being here and supporting this cause. Thank you all. Thank you Wellness Coalition. Thank you Gandhi. Appreciate you all for allowing me the opportunity to take the pictures that you see behind you at the Capitol. This is super historic. This is the right time to do this. It's been the right time to do it. Thank y'all. I really don't have much to say.
Good morning, everyone. Thank you to the Wellness Coalition and to all the many business partners and community engagements that are part of this historic event. In honor of National Minority Health Month, which is this month, we have gathered here today to celebrate the importance of breastfeeding for all mothers and babies, and in particular, communities of color. My name is Dr. Tiffany Taft, and I am an integrative health and wellness therapist, a womb wellness advocate, and a doula. I am a woman in service to other women. Here is what we know. You've already heard many statistics and facts about the stories of breastfeeding and the disparities in our community. Breastfeeding confirms a woman's unique ability to care for her infant in the best way possible. Breastfeeding challenges the views of the breast and not make them merely as part of a sexual organ. Breastfeeding promotes optimum infant and maternal health. So what does breastfeeding offer?
Breastfeeding produces the natural soothing hormones, oxytocin and prolactin, which, if you're in the birthing community, those are key terms that you hear all the time. It increases confidence and self-esteem in the mother. It increases calmness, not only for mom, but for baby as well. Breastfed babies cry less overall and have fewer incidences of childhood illnesses. It protects against allergies, sickness, and obesity, and the list goes on and on. The fact is, infants living in the Southeast are less likely to be breastfed at 6 months than infants living in other parts of our country. It is no secret that Alabama ranks very low, and not in a good way, or very high, depending on how you look at the numbers, in infant mortality death, but also in the breastfeeding arena. There's work to be done. Infants in rural areas are less likely to ever be breastfed than infants living in the more urban areas. Breastfeeding disparities go even deeper when we look at people of color versus the white community. Fewer non-Hispanic blacks, such as our Asian and Latino Americans, also have disparities in this space. Infants that are eligible for state or city, county nutritional programs also may suffer in this space. So why do mothers stop breastfeeding early? 60% of mothers do not breastfeed for any extended period of time past the 6 months. And some of the challenges that they face include lactation issues or simple issues around latching with the baby, which in some cases may not be so simple, but it's a huge issue for a new mom that just wants to simply feed her baby. Concerns about infant nutrition and weight. Mothers concerned about taking medications while breastfeeding. Unsupported work policies and lack of parental leave. Cultural norms and lack of family support, and unsupported hospital practices and policies. All of these play major roles in why moms don't continue to breastfeed or may not even start at all. Black mothers and breastfeeding. Alabama and breastfeeding rates, as I mentioned, are among the lowest in the nation. According to the CDC, just 68% of our babies in Alabama are breastfed, and that number drops to 36% by the time they turn 1. So from my doula perspective, there's several different ways that the postpartum doula can support mom in her 4th trimester of care. In particular, the area of breastfeeding can prove to be very challenging to first-time or new moms, but also an opportunity to create the most beautiful moment of bonding and a sense of accomplishment. The postpartum doula can help mom with these few simple steps. She can help her to manage her engorgement, which is an enlargement due to her milk production coming in. This is liquid gold from day 1. She can teach her how to get a good latch. There's nothing like the good latch when baby is being fed. She can talk her through nipple concerns and care. This is often a major deterrent for moms because it simply hurts. And it shouldn't hurt like painful tears in a bad way. It may be uncomfortable, but it shouldn't hurt to that extent. The doulas who are trained in this space, birth doulas get basic training in this space, but there are other professionals that certify in this space, and they are lactation counselors and IBCLC, I believe it's called, which is the highest level of a certification in this space. And so for moms that really find that they have great challenge, there are professionals in the birth space that have been trained to help her. The postpartum doula also offers evidence-based information on diet and milk supply, because this is often a space where mom can't just eat anything and expect the milk to come in, or expect the milk to be in ample supply for feeding her baby. So nutrition is still very much important in this fourth trimester. The postpartum doula can also provide pumping support and a pumping schedule. Schedules are super important when you have newborns, especially if you are a working mom. But it also sets up room for goals and achievements for mom to feel like she has won and is doing well in this space in providing the best form of nutrition for her baby. And doulas can offer relationship-based care beyond the breastfeeding tips and hacks, because let's be honest, it's about community, and it's a relationship that we as doulas develop with these mothers and their families. It is not about the politics, it is not about the paperwork. It is about the person in front of us and how we can support them in their most important day. So how can you help? Lawmakers, community leaders, parents, hospitals, and community. Continue to celebrate state achievements and events like this one that's being held today in breastfeeding and breastfeeding supportive maternity care practices. Identify the gaps and opportunities for improvement in maternity care practices. Bring together partners to promote and support breastfeeding. Prioritize the next steps to put into action best practices and policies in maternity care. And finally, do the work. Make the changes. Engage the community and its non-medical support birth working professionals who know what works. So with that, I'll leave you with a poem by Grain Evans entitled Breast Milk. Some say it's nature's liquid gold, a gift more precious than any sold. Some say it forms a bond like no other, of connection and trust between baby and mother. Some say the milk babies get from their mamas is the superfood you can make in your pajamas. Some say it's unique and cannot be matched. Its secrets impart when baby is latched. Some say from Hera's breast, the spray formed what we still call the Milky Way. Some say it's powerful healing elixir, a mysterious, milky, all-around fixer. Maybe it's a little of all of the above, but I like to say it's liquid love. Thank you so much for joining me.
In closing, just to wrap up our campaign and this press conference, Dr. Taft has given some great points of what you can do to help normalize breastfeeding, but I also have a few points that I would like to say. What can each of you do to help with normalizing breastfeeding? I ask that you share the information that you learned today with someone else. Also, encourage mothers to talk to their pediatricians about the importance of breastfeeding. Also, our Lifestyles campaign cutouts are behind us, but I would like for you to scan the QR code, which directs you to our website, www.thewellnesscoalition.org, in order to learn more about breastfeeding and what is in our community. And also, do what you can, whatever is in your power, to help support a breastfeeding mother. They need our help, no matter if it's giving them a snack or a break, just so that they can compose themselves to come back and be the best mother that they can be. To our wonderful speakers today, thank you for lending your support and your voices with this historical campaign. Thank you all.